Welcome, everyone, back to our amazing interview series. Steve here, clinical educator and pharmacist at Town and Country Compounding. John Herr here, owner at Town and Country Compounding. Thank you so much for your time. Really appreciate it.
We always like to make these announcements and put this information out for our patients and just people in general.
Yep. And this is a very important topic. And thank you and kudos to Oprah for talking about something that's deeply personal to her. And, she experienced fat shaming for over, what did she say, 25 years? Something like that, or 20 years, where she was just getting destroyed by the public for her obesity. And she lost weight, gained it back. And it was really nice seeing the perspective that she brought from patients, including children, right? How do you think Oprah's interview brought light to specifically GLP-1 medications, Semaglutide, Tirzepatide, and how does this change their approach to obesity?
So I think Oprah has brought it to everyone's attention because we've seen her over the years with her up and down in her weight, and many other celebrities also, and especially women, and actually that fat shaming causes a lot of anxiety. It causes these people to feel like they're doing something wrong.
Right.
And I think when Oprah kind of made the break initially from Weight Watchers, everybody thought, well, what's going on with Weight Watchers? Is it not good?
Yeah, I remember that announcement. Yeah.
Yeah, but I think on her show, when you watched it, she had the people from Weight Watchers there, and what it amounted to was Weight Watchers is now also adopting these GLP-1s in their protocol. So I think by Weight Watchers using this, by Oprah bringing this to everyone's attention, people are going to really benefit from these medications.
Yep.
And it can be women and men. It can be socioeconomic. It can be diet. There's a lot of things that go into, weight gain. But, since 2008, the obesity in the United States has increased 26%. And our life expectancy due to obesity is down 10%.
Right.
So there's a lot that we have to do with this. And I think the whole thing, again, with Oprah and the Weight Watchers, it's saying, yeah, you can use the GLP-1s, but you also have to, follow, what Weight Watchers will do is teach people how to eat correctly, how to eat healthy, portion size. But again, I think what Oprah brought out, especially with some of the younger, adolescents that she had on the show, where they were saying, it isn't just a matter of like calories in, calories out. There is a biological factor here. Right. And I think what has, finally unlocked some potential for weight loss are these GLP-1 agonists.
Correct.
People probably hear the names like Ozempic and Mounjaro. They certainly help with hemoglobin A1C, decreasing that for people with diabetes. And as we know, why obesity, has probably decreased our life expectancy, because it is increasing the risk of heart disease, cardiovascular disease. So you're getting the benefit of, lowering and decreasing your weight, but also decreasing your hemoglobin A1C, which is going to lead to, a healthier lifestyle.
Yeah, cardiovascular risk also decreased. That's our latest study as well. So it's like hitting so many different parts of your healthcare journey. I guess with a nationwide shortage of commercial GLP-1s, such as Ozempic, Mounjaro, how are compounding pharmacies like ours, Town and Country Compounding, filling this gap?
Well, when a drug is in shortage, the FDA allows compounding pharmacies to compound that medication. It's not considered a generic. It's not doesn't have an approval from the FDA. It's a compounded version. We're allowed to actually produce that and sell it to patients on what we call a patient-specific prescription from that practitioner. And the thing we caution people is make sure you go to an accredited compounding pharmacy. You should ask them if they are accredited. Are they doing testing? Like in our pharmacy here at Town and Country, we test every batch with an independent FDA-registered laboratory, and we quarantine that batch until we get our test results back, and then we can release it.
Right.
There's also things that people don't realize. There's what the FDA says, salts of the semaglutide, for example. So the manufacturer's product is semaglutide. And that's what we use here at Town and Country. But there's people that have been using things that the FDA and the state boards of pharmacy don't like, such as semaglutide sodium.
Yep.
And it's also, again, why you use an accredited pharmacy, because it has to do with the grade of the active ingredient. There are what they call research grade. And I think a lot of even physicians got confused because they think that research is, it must be better.
Yeah,
but actually,
it sounds better.
Yeah, it sounds better, but research grade is not. It's really, research grade is just for playing around in the lab. If you can.
Lab mice.
Exactly. Animals, just, is it soluble? But unfortunately, people are getting this and using it. And obviously, this is not from an accredited compounding pharmacy, but it's causing a lot of misinformation in the media.
Yep, absolutely. Um, in what ways do you believe addressing the biological roots of obesity and reducing shaming can contribute to a healthier society?
Well, in general, I think, what we found is the patients on these drugs is that, they just can't eat as much, number one. So initially, especially when you start on these drugs, you can't eat as much and, you feel satiated. Eventually, that can, over time, as we're seeing this for longer and longer, start to wear off a little bit. So that's where I think, like, working with like a compounding pharmacy like us, with Weight Watchers, working to try to like learn a better, diet, using proper exercise is going to be the long-term goal of this. There's also some supplements you can take, as you're going through this journey. We particularly like two from Orthomolecular. One's called high phenolic, which has to also do with decreasing those cravings. In our country, we have a big sugar diet. When you have a big sugar diet, you get cravings for more sugar. It has to do with the way we process insulin. Then another product I like of theirs is called Hepaticore. So Hepaticore actually works on your liver so that your liver can better metabolize fats. So I think those are two good supplements that you can use with the GLP-1s.
Yes.
And obviously, like we discussed, with, proper diet, nutrition, and things like that.
Got it.
And then, what we see here a lot of Town and Country Pharmacy, we've always been big believers in balancing your hormones. We're more integrative in our approach. So my big thing, Steve, I always tell people is that we say we're in healthcare in the United States, but in reality, we're in sick care. Our system is set up that, we wait until we have a disease, and then a pharmaceutical company wants to, produce a pill that will actually counteract what the disease is causing.
That's right.
Such as in high blood pressure or cholesterol. And it's rather than changing your diet, it's easier to take a drug to lower your cholesterol. So the way we focus is try to prevent disease, be healthier.
Right.
Then what we see, and we've worked in women's health for many years, and if you're a woman listening to this and talking to your girlfriends, when you start to go through perimenopause and menopause, we always hear the same thing. My hormones have changed. I'm exercising harder. I'm eating less. I'm eating healthier, and I'm gaining weight.
Yeah.
And a lot has to do with hormones.
Right.
So again, I think the GLP-1s may play a role with hormones. Maybe, you should be talking to your practitioner, or you can call us here at Town and Country. We can refer different practitioners who work in the integrative space. Maybe you should look at balancing your hormones, balance your estrogen level, your progesterone level. I think that also goes along with what they call longevity medicine or healthy aging.
Right. And same thing for men's health. Men can also have a hormone imbalance, andropause, it's called, the male version of menopause. And that's kind of the beauty here is that whether you're a man or a woman, you can have a consultation with a pharmacist that's specialized in taking care of you holistically, this integrative approach, help order the right labs, and then we have the right compounds to treat all those intricate issues, because it's not necessarily just a GLP-1 problem, right? It could be more complicated than that. GLP-1s are obviously really great. They're very popular. It's like this thing that kind of boosts you and helps you lose that weight. But, people can have complicated issues from it.
Oh, sure. You got to look at your thyroid levels, both men and women. But I think these GLP-1s have really just opened up the door.
Yes.
They've really opened up the door, and it's really been amazing, the results that patients are getting with these medications. And, the idea though is, you can't just say this is the one thing that's going to do it forever.
Right.
That's why we kind of say being more integrative in approach. Use the GLP-1s. It's going to help. It's going to help you with those cravings. It's going to decrease your hemoglobin A1C. It's going to make you feel more satiated.
Yep.
So you don't have those hunger pains. But again, balance everything else in your body.
That's right. And since this conversation is going so well and we're so excited, we need to talk about sublingual semaglutide.
Well, that's something new that we have.
At least from a very high level. We're going to have a whole series, and we're going to go into the nit and gritty of the sublingual. But how exciting is this for some patients that are needle phobia and all that,
Yeah, there are those patients that just won't inject it. The commercial medications and even medication that we compound needs to be injected. It's once a week. It's subcutaneous. It's not a painful injection, but there are really needle phobic people.
Yep.
So the sublingual base, that we now have, may be an alternative for those patients who just refuse to inject. I mean, the difference is though, you have to use it every day as opposed to once a week, and we're finding that. With this, maybe down the road, is it something that could be used to help people maintain weight loss? Did they go through, a few months or 6 months, whatever it might be, of one of the GLP-1s and then stop the injection, and maybe they can use the sublingual? Or like you said, just somebody who's afraid of needles. It's just something else that we have to offer here at Town and Country. Not saying that it's we can't compare it. We can't say it's indicated for this. We just again want to make sure that people understand it is available for those people that just don't want to use an injection.
Yeah, and that's like the beauty of a compounding pharmacy for personalized medicine. We have the ability to make a medication in exactly the dosage form and exactly how it's best for you, while a regular pharmacy is restricted by commercial available products.
Well, that's the problem because a lot of these drugs, the commercial products now, in our country and all over the world, they're just in short supply.
They're
So
just not even
even
available.
right in a regular retail pharmacy or mail order pharmacy, they just can't get the medication because of the shortage. So as compounding pharmacies, again, we were able to step in, help the supply chain and supply these medications. To patients that need them. Again, we're not a generic. We're not considered, an alternative. It's simply a compounded medication. But then I always caution the patients and, physicians who are listening, reach out to your pharmacy, ask them, are they accredited? Are they doing testing? Are they using the base form of the medication? These
Right.
are good questions that, even the public should ask, but particularly, prescribers should be asking.
Awesome. Well, it was a pleasure talking to you about this because I hope it brings awareness for people that have experienced fat shaming sometimes all their entire life. And finally, there's an option that gives them that boost.
Oh yeah, and if you haven't seen the Oprah show, you can certainly go to our website. I think we at tccompound.com.
We'll have the link in the
And
video
we'll
too,
have
right here. Click it right
and
here.
we'll have the link, and it is worthwhile to see because really Oprah did a really good job at just bringing this to everybody's attention.
It required a lot of courage.
Yeah,
Yeah.
and especially those people that were on the show there, so some of those younger girls.
That girl.
But you could see how it changed their lives.
Yeah. What a hero.
Yes.
What a hero. Thank you guys for watching.
Thanks.